Well, welcome back. We're continuing our series of getting to know our new faculty, and I'm really fortunate to be with Dr. Mitch Dyer today. So Mitch, thanks so much for joining us. Even though we've had trouble connecting, we did this video earlier. We've been talking about that. We can't really remember, but it got lost into video space.
That's right.
Tell us where you grew up, and then we'll get into how you got into medicine.
Yeah, I actually grew up in Wisconsin. I'm from a little suburb of Green Bay called Ashwaubenon, usually one of the typical suburbs that they have the Packer players try to pronounce and they can't. But I grew up in Green Bay and went to high school at Ashwaubenon High School and then stayed here for college before going off to medical school.
Yeah, that's right. You were at the University of Wisconsin.
That's right, yep.
And then decided to leave the state.
I did, yeah. It was time to venture out of the nest.
So Pittsburgh?
Yeah, so I went to the University of Pittsburgh for medical school, had really great mentors there, and was lucky enough to stay there for general surgery residency, where I performed a 3-year research fellowship, and then loved it so much I stayed on for a 2-year fellowship in vascular surgery as well.
So my goodness, those years start to add up then.
Yeah, it was.
So we had 4 years of medical school.
Yep.
And then And then I just have to ask, did you become like a little bit of a Steelers fan since you were in Pittsburgh?
Not at all.
Okay,
nope,
good.
Nope.
We were going to turn the video off there, right? So, so you did 4 years of medical school, 5 clinical years of residency, 3 in the lab. So 4 and 5 is 9, and 3, we're already at 12.
Yep.
And then vascular surgery, 2 more.
2 more, so total of 14.
Oh my goodness.
Yeah, 14
Wow.
years in Pittsburgh. So.
Wow. How did you get interested in medicine, and then maybe tell us also how once you got involved in the University of Pittsburgh Medical School, how surgery became the answer?
Yeah, so medicine kind of grew out of an interest in science, and then I thought I was going to pursue a graduate degree and go into like peer research with a PhD, but I felt I wanted a more human connection part of my job as well. So did some volunteering in undergrad and fell in love with the idea of medicine, and then went out to the University of Pittsburgh, and really it was perchance I thought I was going to be a pediatrician when I started medical school, but I started working with some surgeons, and the very first day I met one of them, he brought me into surgery, and I thought it was one of the greatest things I had seen.
Wow.
So I fell in love, and it was really just a perchance thing to find myself in surgery, but really great mentors that led me that way.
So many people, it's just that kind of really inspirational experience they get working with someone, and then you get a keen interest in that. It's just fascinating.
Yeah.
How about vascular surgery?
Yeah, so I actually then thought I was going to be a pediatric surgeon because that was my mentor's career. And then just really figured out that emotionally I don't think I was meant for pediatric surgery. And I fell in love with vascular surgery for a couple reasons. We operate kind of from the neck all the way down to the toes. And we have
you get to operate on people multiple times.
Yeah, we do, yes.
Just a little joke in there.
And we have a dual skill set. We can do open traditional vascular surgery, but with the advancement in technologies in our field, we have a whole skill set in endovascular surgery. So I like that dual nature of it,
Sure.
and I find it constantly challenging.
Oh boy, I would say it is, and the number of patients that all of you treat in the division of vascular and endovascular surgery here is just staggering.
We're very busy here, yeah.
Very busy. Tell us about your research interests, because you're one of our physician scientists in the department and really hoping to move the field forward, do things differently 10 years than we're doing it today.
Yeah, absolutely. So as we talked about, I did a 3-year research fellowship during my residency, and that really inspired a career as a surgeon scientist where I split my time. About half of my time is spent dedicated to developing a basic science research lab with a focus on thrombotic disorders and trying to develop better therapies, more targeted therapies. Specifically, I work under the mentorship right now of Christian Kastrup, who's a PhD in biochemistry and is really one of the leaders in the field of RNA therapy. So similar to like the COVID-19 vaccines, he's really advanced that field. So we're utilizing that technology both as a tool to understand the biology, but then also use it as a therapeutic.
Yeah, so fascinating. I think we actually have a little video. Sarah, you can correct me if I'm wrong. I think we have a video with Christian talking about that. But really, I mean, there's so much clinical utility in finding ways to prevent people from bleeding and to prevent people from clotting too much. I think anyone who watches this video knows that pulmonary emboli, deep venous thrombosis in the leg. I mean, so much of medicine is spent dealing with people who clot too much, and then obviously for people who get into a car crash or various other aspects of trauma, people bleed too much. So there's no place on earth where a research program is just so compelling as yours is with Christian to really make a difference in the world.
Yeah, I think there's plenty of opportunity, and it's all about finding that balance. And I think really to drive that, we need to understand the biology better. And we have this really unique tools in this RNA therapy to utilize it as both a tool and as a therapeutic.
Yeah, where do you think we're going in the future with vascular surgery? I know now that people aren't smoking as much. You're not seeing as much tobacco-associated disease of the arteries, but I assume that there's just other problems that fill up your space. Plus, people are living longer, right?
Yeah, exactly. So, unfortunately, diabetes and end-stage renal disease and dialysis have a similar effect as smoking does on the vascular tree. And so, even though we're seeing less smoking-related complications to the arteries and the veins, we're seeing a lot of diabetic and dialysis-induced damage to the vein. So, unfortunately, we're not slowing down in what we're seeing. It's just a bit of a shift in what's the driving cause there. But I think what really is pushing our field forward is the continued advancement of endovascular fixes, especially in complex aortic disease, where we're able to fix things all through just little groin incisions that used to require an incision across the chest and the abdomen and 2 weeks in the ICU. We can now kind of cut that down, and our technology is ever advancing with all of that.
Yeah, so exciting. Last question, Mitch. Outside of the hospital, I think if I recall, there's like some Ironman competitions in the past, and you still doing that stuff?
Yeah, I have a little bit of a hip injury right now, but the plan is to get back. It's perfect timing. The Ironman World Championships is this Saturday in Kailua Kona, Hawaii, so it marks my 6-year anniversary of competing in the Ironman World Championship. So goal is to get back to Hawaii one day for another go at it.
And they always have it in Hawaii?
They used to. Now they alternate between Nice, France, and Kailua Kona for the races.
Wow, 2 pretty nice places.
Yeah, not bad either way, right?
Yeah, that's great. Well, Mitch Dyer, thanks so much. Really great to spend a few minutes with us. A lot of people will love this video. And thanks for being an incredibly important part of the department.
Thank you. I'm just very happy to be here.
Great.